Hey YouTube, Aaron Davies here. This is the Heart Dad Show, episode 2, and today we're going to talk about whether or not you should hold your child when they're in the intensive care. This is something that every single one of us heart parents struggle with. Think about just a normal parent when they give birth to a child. What's the first thing they want to do? They want to hold the baby. And then when they go home, they hold the baby every day, and they hold the baby all for hours a day, and it is 6 months, a year, and they hold the baby all the time, right? That's just a natural parent thing. But when your child is hooked up to wires and IVs, and maybe they're intubated, you don't have that same opportunity, do you? So let's say you just had your baby, and they're in the intensive care, and you walk in. What's the first thing you're going to see? You're going to see something that looks like this. Pause for dramatic effect. And for most of us, unless you actually work in a NICU, you're going to be terrified at this moment and not want to break anything. You have no idea what's going on. But the other thought that's going to run through your mind is, when do I get to hold my baby? So with all those tubes and all those wires, it could be super intimidating, and maybe you don't even want to ask if you can hold the baby. Not only that, but the nurse that's taking care of your baby, especially if they're an inexperienced nurse, they may also be intimidated by letting you hold the child because you're a new parent. They don't know you. So there's some trust to be earned. There's a lot of questions, and a lot of parents just don't do it. And that's really sad. So today I'm going to talk about when you would hold the baby, when you would not hold the baby. And I'm also going to provide you with some links that will hopefully help you to better advocate for your child in this situation. There is an absolute wealth of studies out there that show how important it is to hold your child, especially when they're young, when they're small. It not only helps them when they're sick get better, but it also has all sorts of benefits long-term for the child, holding them early. Not only them, but you. So there's an emotional attachment a parent gets with a child when they first hold it. You don't really need studies to prove this. It is absolutely obvious to any parent out there that holding your child is important. How important is it though? That's what some of these studies get into, and they talk about how your child can actually heal faster if you hold them. There's just all sorts of benefits to holding your child, and they should not be understated. The first couple times I held my son, I was absolutely shocked. I sit down, my wife's over here, hold the baby, and I look up at the monitor and I go, holy crap, is that my imagination, or are his sats actually doing better? Like, did his blood pressure actually come down a little bit? Is his heart rate actually sort of getting a little bit back into the normal zone? Like, what is going on? Is this just my imagination? And my wife looks at me and she's like, no, that is you. That's what parents do when they hold their children. The child just sort of automatically gets comfortable, settles down, things automatically start looking better on that monitor, and you will be amazed just how the simple act of holding your child can help them so much in the moment. So for the question of whether or not you should try to hold your child when they're intubated, when they've got all sorts of IVs coming out of them, when they're tiny little preemies in the NICU and they're 32 weeks old, should you even try? The answer is unequivocally yes. You should try. Now, that said, there's always going to be some situations where you should not hold the baby, and I'm going to cover a couple of them real quick. One of those situations is going to be like if they're in a really critical state. For example, they're in SVT and their heart rate is going up to 200 beats a minute. You're not going to hold the baby in that situation. Same thing is true if maybe they just had open heart surgery, they've just come back up to the room, their chest is still open, there's like a really high risk for infection at that point. You're not going to hold the baby. These are super obvious, right? And one other situation that's super obvious to most of us, but unfortunately we see this all the time, you should not hold your baby when you're sick, especially if they're in this immunocompromised state in the NICU. I totally get it. You want to come in, you have a sick child, and you're also sick, and you think if I wear a mask, it's going to be okay. I'll just come in and hold the baby for a little bit. I'm not affecting anyone else. I'm just going to hold my baby because they really need me today. And I totally get why parents do that. But if you're sick, please, please, please stay home. not for just for your baby's sake, but for all of the babies in the ICU or the NICU. A cold for a 30-week-old baby is not the same as a cold for a regular normal toddler. There's other less obvious situations. One of those would be, let's say your child is having trouble growing and they've just increased their food, and the nurse is sort of concerned that they might throw up if you were to stimulate them. It's totally reasonable at that point for the nurse to say, you can't hold the child for the next couple hours. Maybe the same thing happens with medicine. Let's say they just put them on a new med and they're sort of worried about the stability of that med and they want to wait overnight and make sure that the child is okay. Same situation. It's reasonable. There's an end date to when you can hold the child. And that brings me to my next point. There has to be an answer to that question. When can I next hold the child? And the answer should be tomorrow, in 3 hours. The answer should not be when they get bigger. When they go home with you, you can hold the baby. We're not going to have you hold them when they have all these IVs in. It's just too hard for us to move them around. So here's a couple scenarios where that I would personally push back as a parent. And again, this is my opinion. Every situation's different. I'm not a medical person, but I've been in these situations, and here's how I've sort of handled it. So if you read up online, can I hold a baby when they're in the NICU? Can I hold a baby when they're 30-something weeks old? You'll see all sorts of forums where parents are talking about this exact problem. So do not think this is some isolated thing. This is hospital by hospital, nurse by nurse. You will have different experiences based on who you get. Situation number 1, the baby's too small. They're 32 weeks old. We really don't feel comfortable with you holding the child. Now, if you ask that question from earlier, when do I get to hold my child? It sounds like the answer in that situation is when they get bigger, which could be weeks or a month, and that's way too long, okay? So how do you push back on that? I'm going to act as your midwife here, or maybe like a mid-husband, if that's a thing. Listen, I totally understand your concern, but I held my child yesterday, okay? Nothing's changed. He's doing really great with diaper changes. He's doing really great with his mouth cares. You know, when we go in and clean his gums out. I am good with this. I want to hold my child, and I have the right to hold my child. So let's make this happen, okay? And call a charge nurse in. Get a second opinion. Ask for a doctor to come in the room and see what they say and bring up the same concerns. With most people are reasonable. This is also where consistency of care becomes super important. When we were at the first hospital we were there for over 100 days. And I stopped counting nurses after we hit 100 different nurses. I don't care what the excuse is. 100 nurses in 100 days is completely unacceptable. And what you end up getting when that happens is inconsistent care. You'll have a nurse come in one day that says you can't hold the baby. And then you'll have a nurse that comes in the next day who's super experienced. And that's my wife, okay? She walks in and says, hey, Dad, hold the baby today for 2 hours. Whatever it is. And Dad's like, I don't want to hold the baby. I'm scared. I'm going to break the baby. And the nurse is like, tough. Go to the bathroom, eat, get ready, because you're holding the baby today. One of the best ways you can advocate for your child in this situation is to simply ask for the same nurses every day and push on it. If you get an experienced nurse every time, if you find nurses you like, maybe there's 4, 5, 6 of them, they usually only work 3 shifts in a row, so you're going to need more than one, and you have night shifts and day shift nurses, so you need to find night shift nurses you like and day shift. Ask for those nurses. Ask to have them every time you come on, because if you don't, you're going to end up being super aggravated when somebody else comes in that doesn't know what food your baby likes or how their skin needs to be treated, or that they like to lay on a certain side, or whatever it is. There's just like all sorts of things that you get from consistency of care, and one of those things is being able to hold your baby. Another point about that is if you're going to hold a child that's got wires, tubes, maybe they're intubated, this is a commitment. This is not, I'm going to do this for 10 minutes or 15 minutes. You're going to do this for 2 hours. You're going to nurse beforehand. You're going to eat. You're going to go to the bathroom. You're going to get your iPad in one hand, whatever you're going to do. You're going to sit down and you're going to hold the baby for 2 hours, 3 hours. It's not a short thing when a child has all sorts of wires and stuff hooked up to them. Let's say that they're intubated. This is actually a really hard scenario. If they're intubated, their tube has to stay in place or they stop breathing, right? So it's really freaky. Can you hold a child when they're intubated? And you totally can, depending on the hospital and depending on the nurse. Some places will say you can't, some say you can. We could. I've linked some correct procedures below. I think it's, I forget what the hospital is. It might be CHOP. That I link below that talks about holding a child that is intubated. It's a whole procedure. But even in that situation, you should totally hold your child if they let you. I know that it's a big pain in the butt, and the nurse may not have the 10 or 15 minutes that it takes to get them in that situation. But that's a terrible reason why you shouldn't hold them, just because they don't have time. And one last reason why you should hold your baby. You don't know how long you're going to get with them. You just don't. And I don't mean to be super dramatic here, but if your child is in a state like Nathan was, you might get weeks, you might get months, you might get days. You don't know. So you got to take advantage of every moment. And if that means holding the baby when you're super uncomfortable and they're intubated, but you need to get that time holding them, then do it. If you need me to call your doctor and you need to tell them, hey, that is not an excuse for why they can't hold the baby, I'll do that, okay? Maybe, if I like you. So as always, get educated. Be the #1 advocate for your child. Read up papers. Come in armed with information. Understand why it's important to hold your child. Understand how that builds a bond. How it's important for them later in life. How it's important for their healing right then. And I hope you can find a hospital that will accommodate you. Great, guys. Thanks. I hope you enjoyed this video. I really hope that you got something out of it and that you can advocate just a little bit better for your child today. If you like this, please click the like button. Please click subscribe if you actually want to subscribe to my channel and get updates for more videos like this. And let me know in the comments what other kind of topics you want me to cover. Or if there's things I said that you disagree with, or things that you miss. Because again, a lot of this is an opinion. I know that every situation is totally different. As always, listen to your doctor. For now, I hope you have a great day, and I'll talk to you later. Bye.